Good morning, namaskar, and welcome to Health Hour by Apollo 24/7. Apollo 24/7 brings you experts from Apollo Hospitals every week to this live show. 11 to 12, 1 hour is for your health. All those doubts, all those queries that you have been postponing to ask or visit a physician, we are bringing you experts here onto the show where you can ask questions in the live platform. So here in this platform, your question becomes answer for many people who are unable to answer or ask questions. So you must be watching this on various platforms. You must be watching this on YouTube, Facebook, and Instagram as well. But if you want your query to be answered, if you have a question to be asked, please hop on to the YouTube chat and YouTube channel of Apollo 24/7 where we are live today. You can ask your question in the chat box, and I'm going to place this question before our expert who's going to join us very shortly. I urge you to download Apollo 24/7, which is an app which brings an entire facility of Apollo Hospitals to your palm. Just the click of your finger, you will be able to access entire health services from Apollo Hospitals. On the show, we also have a health quiz coming up, and in this quiz, you can win gift vouchers from Apollo Hospitals as well as Apollo 24/7, and we are going to give you discount vouchers which you can use on Apollo 24/7 as well. तो चलिए, please wait for these towards the end of the show, and आज का topic है paralysis. Paralysis, how to reduce the risk, क्या होता है, क्या treatment options है, all of these we are going to answer, and we are bringing you an expert who is Dr. Vishal Chafale, who is a consultant and interventional neurologist from Apollo Hospitals CBD Belapur, Navi Mumbai. डॉक्टर साहब का 11 years से ज़्यादा experience है, and he can be consulted for headaches, epilepsy, Parkinson's, neuromuscular disorders, stroke, the treatments and preventions as well. तो आज आपके जो भी questions है paralysis के related, we'll be answering your questions, and here's Dr. Vishal Chafale, who's going to join us. Good morning, sir.
Good morning. Good morning, everybody.
It's wonderful having you on a Sunday morning here with us. I know it's a very difficult time for you. It's a very less time that you have, and you have given us this precious time of yours. Appreciate it, sir. चलिए, तो पहले Dr. Vishal, we understand that paralysis is one word which scares off people. But होता क्या है? What is paralysis? And कौन से अंग या which organ causes paralysis? What happens to us?
पैरालिसिस मींस ब्रेन स्ट्रोक. जैसे हार्ट अटैक होता है वैसे ब्रेन अटैक, उसको बोलते हैं हम पैरालिसिस. पैरालिसिस को ही हम हिंदी में लकवा भी कहते हैं. पैरालिसिस के सिम्टम्स डिपेंड करते हैं कि ब्रेन में कौन सा पार्ट अफेक्ट हुआ है. तो नॉर्मली हम पैरालिसिस में देखते हैं कि एक हाथ कमजोर हो गया, फेस कमजोर हुआ, एक बॉडी एक साइड चली गई. वो कॉमन फॉर्म ऑफ पैरालिसिस है, पर जरूरी नहीं कि एवरी टाइम आपको वही सिम्टम मिलेंगे. पैरालिसिस के सिम्टम डिपेंड करते हैं कि ब्रेन में कौन सा पार्ट अफेक्टेड है. सपोज मेरा बैलेंसिंग वाला पार्ट अफेक्ट हो गया स्ट्रोक में, तो रादर देन हैविंग वीकनेस, आई मे हैव बैलेंस प्रॉब्लम, आई मे हैव वर्टिगो, आई कैन हैव डबल विजन, समटाइम्स आई मे बी डिसओरिएंटेड, समटाइम्स स्पीकिंग डिफिकल्टी. सो ये सब सिम्टम पैरालिसिस के हो सकते हैं. पैरालिसिस बोले तो ब्रेन स्ट्रोक या फिर हिंदी में हम बोलते हैं लकवा, या फिर अर्धांग वायु, मराठी में कहते हैं अर्धांग वायु.
ओके, सो हम ये लेट्स अंडरस्टैंड, जो आपने सिंपल सी भाषा में बोला है कि जैसे हार्ट का एक स्ट्रोक होता है वैसे ब्रेन का भी एक स्ट्रोक होता है, जिसके वजह से हमें थोड़े अंग ढीले पड़ सकते हैं या काम नहीं कर सकते या पूरी तरह से भी काम में ना आए. तो टाइप्स ऑफ पैरालिसिस है जो आपके फर्स्ट इनिशियल टॉक से मुझे समझ में आया. क्या टाइप्स है सर?
टाइप्स पैरालिसिस के हम जनरली दो टाइप्स मानते हैं, एक हिमोरेजिक स्ट्रोक एंड दूसरा इश्केमिक स्ट्रोक. हिमोरेजिक स्ट्रोक में क्या होता है कि ब्रेन के ब्लड वेसल्स में से ब्लड लीक हो जाता है, एंड वो पार्ट में पैरालिसिस, वो पार्ट ब्रेन का अफेक्ट होता है, उसके वजह से पैरालिसिस के सिम्टम आते हैं, जिसे हम बोलते हैं हिमोरेजिक स्ट्रोक. मोर कॉमन स्ट्रोक इज इश्केमिक स्ट्रोक. इन इश्केमिक स्ट्रोक व्हाट हैपेंस, ब्रेन का जो ब्लड सप्लाई टू दैट पर्टिकुलर पार्ट इट गेट्स अफेक्टेड, क्योंकि क्लॉट जाके वहां पे एक आर्टरी को ब्लॉक कर देता है, या फिर पार्शियली ब्लॉक हो जाता है, या फिर उस पार्ट का ब्लड सप्लाई कम हो जाता है. उसकी वजह से वो पार्ट को ब्लड सप्लाई प्रॉपर नहीं मिलता है, वहां पे डैमेज होना शुरू हो जाता है. इनिशियली हम बोलते हैं इश्कीमिया, देन इन्फार्क्ट इफ इट इज नॉट ट्रीटेड ऑन टाइम. सो अगेन ये ब्रेन के कोई पर्टिकुलर एरिया में होते हैं इन वेसल डिस्ट्रीब्यूशन एंड उसके हिसाब से हमें सिम्टम्स आते हैं. सो ये स्ट्रोक के दो प्रमुख कारण है. 85% आर स्ट्रोक आर इश्केमिक स्ट्रोक एंड 15% दे आर अराउंड दे आर हिमोरेजिक स्ट्रोक्स.
ठीक है. सो ये वार्निंग कुछ होता है क्या सर, जो हम जनरली एज ग्रुप्स में भी देखते हैं? हमें लगता है कि ये बड़े एज ग्रुप में होते हैं, बट आजकल हम देख रहे हैं कि वेरिड एज ग्रुप्स में भी प्रेजेंट होता है पैरालिसिस. तो कौन से जेंडर, कौन से एज, कौन से रिस्क फैक्टर्स है इसमें?
As you mentioned, stroke is a disease of elderly, but it is not restricted to the elderly. If you ask me, around
जी.
10 to 20% population are young. In fact, I myself have done thrombectomy, stroke treatment by doing thrombolysis of 19-year-old children, means young adults. I have done thrombectomy. So
जी.
stroke is not only elderly problems. Yeah, it is more common in elderly population, but it can occur in young population in 10 to almost 10 to 20% patients. सो स्ट्रोक के स्ट्रोक के रिस्क फैक्टर्स वो एल्डरली में कॉमन रहते हैं. यंग पेशेंट में जब
जी.
स्ट्रोक होता है तो सेम रिस्क फैक्टर जरूरी नहीं कि यंग पॉपुलेशन में हो. तो अगर कोई यंग पेशेंट कम्स विद अ स्ट्रोक, हम उसे इन्वेस्टिगेट करते हैं बिकॉज मोस्ट ऑफ द टाइम हमें दूसरा कोई कारण मिल जाता है जिसे हम ट्रीट कर सकते हैं, उसको आइडेंटिफाई करके हम प्रिवेंट कर सकते हैं स्ट्रोक. सो स्ट्रोक इन यंग इज ऑल्सो कॉमन, नॉट अनकॉमन.
राइट, राइट. सो इसका एज के रिलेटेड, एज इज अ फैक्टर, रिस्क फैक्टर, बट यंग पीपल ऑल्सो कैन बी अफेक्टेड. तो इमीडिएटली हम कैसे आइडेंटिफाई करें? दीज आर वेरी इंपॉर्टेंट क्वेश्चंस दैट people are asking. A lot of people have joined us. कमल जी पूछ रहे हैं, जयप्रसाद जी पूछ रहे हैं. All these are asking questions. Let me start with our audience's question. Ramya Nagraj is asking let me take hers as the first question. What can be the first aid if we identify that there is a stroke? So ये क्या है which we always listen कि immediately act करो?
सो जैसे मैंने बताया, स्ट्रोक के सिम्टम वेरिड रह सकते हैं. एज अ ले मैन और एज अ कॉमन पर्सन समटाइम इट बिकम्स, पहले तो एक्सेप्ट करना डिफिकल्ट हो जाता है कि हमें स्ट्रोक आया, हम वैसा सोचते नहीं है. तो कोई भी
जी.
सिम्टम, ब्रेन का कोई भी सिम्टम कुछ मिनटों में हो रहा है तो स्ट्रोक हो सकता है. सपोज कोई बात कर रहा है और सडनली बात करने में तकलीफ हो रही है, कोई फेशियल
हाँ.
वीकनेस डेवलप हो गया है, किसी का हाथ अगर
एक्साइट आ रहा है.
डिफिकल्ट, या फिर हाँ, या आपको वीकनेस हो गया, इनकोऑर्डिनेशन हो गया है, एनीथिंग विच हैपन्स विद इन फ्यू मिनट्स कैन बी अ स्ट्रोक. तो ऐसे कोई सिम्टम्स आते हैं तो इमीडिएटली हमें नियर बाय हॉस्पिटल में जाना चाहिए, बिकॉज वही एक गोल्डन पीरियड रहता है स्ट्रोक ट्रीटमेंट का. आइडेंटिफिकेशन इज वेरी इंपॉर्टेंट. तो हमारे इसमें बोलते हैं कि एक्ट फास्ट, एक्ट FAST, दैट इज अ कोड वर्ल्ड वाइड. हम उसको प्रमोट करते हैं अवेयरनेस लाने के लिए. सो बहुत से लोग वो आइडेंटिफाई करते हैं, हमारे पास आते हैं तो आइडेंटिफाई करके कोई लेके आते हैं आसपास के लोगों को. तो फास्ट हम जब बोलते हैं तो फास्ट इज F स्टैंड्स फॉर फेशियल वीकनेस, A फॉर आर्म ड्रिफ्ट, S फॉर स्पीच प्रॉब्लम एंड T is time. So don't waste time. That is very crucial in stroke treatment.
So
Because
ये
brain is
याद रखिएगा, FAST, फास्ट. कोई भी
yeah.
सिम्टम आपको लगे कि ये ब्रेन स्ट्रोक है, फेस में जा रहा है साइड, स्पीच में स्लरी हो रहा है, आर्म में वीकनेस हो रहा है, टाइम रिएक्ट कीजिए. एंड व्हाट इज द टाइम है जो आपने बोला गोल्डन टाइम है? क्या विंडो है, क्या ब्रैकेट है इसका?
सो स्ट्रोक इज ट्रीटेबल. हमें बहुत से लोगों को ये पता नहीं रहता है कि स्ट्रोक का भी ट्रीटमेंट रहता है. हम बहुत सा जो इंपॉर्टेंट टाइम रहता है, इमीडिएटली जो गोल्डन पीरियड रहता है, जिसमें सी ब्रेन इज वेरी सेंसिटिव टू इश्केमिया. अगर
जी.
कुछ होता है तो एज कम्पेयर टू अदर ऑर्गन सबसे ज्यादा अफेक्ट ब्रेन के ऊपर होता है. और अनफॉर्चुनेटली जितना लेट करते हैं हम ट्रीटमेंट, जितना ब्लड सप्लाई उसका रिस्टोर करते हैं, लेट करते हैं, उतनी रिकवरी में डिले होता है या फिर नहीं आती है, क्योंकि ब्रेन डैमेज हो जाता है. सो जो गोल्डन पीरियड है वो ब्रेन के लिए कम रहता है एज कम्पेयर टू हार्ट. तो हम बोलते हैं ट्रीटमेंट ऑफ स्ट्रोक थ्रोम्बोलिसिस इज पॉसिबल अप टू 4.5 आवर्स. सो स्ट्रोक के
अच्छा.
सिम्टम जब आते हैं विद इन 4.5 घंटे, मैं तो बोलता हूँ 4.5 घंटे वेट एज अर्ली एज पॉसिबल, बिकॉज अर्लियर वी ट्रीट, अर्लियर वी कैन रिस्टोर द ब्लड सप्लाई एंड वी कैन प्रिवेंट द ब्रेन डैमेज. और कुछ कुछ 4.5 घंटे में नहीं आ पाता है लोग, तो हम थ्रोम्बेक्टोमी का एक ऑप्शन रहता है जो हम बाद में भी कर सकते हैं, बट अर्लियर इज बेटर. 6 hours.
Right.
Now we have new recommendation up to 24 hours भी हम ब्रेन की ब्लड वेसल्स ओपन कर सकते हैं. So this is the golden period.
Right.
If you ask me, it is 4.5 hours for the stroke.
4 to 4.5 hours immediately react कीजिए. That's what Dr. Vishal is suggesting. So treatment options जो आपने बताए हैं, other than these injections, other than prevention, वो बाद में बात करेंगे, reducing the risk. But what are the treatment options जो आप thrombectomy, if I'm not wrong, if I've heard the right, आप तो interventional neurologist है. It's not just neurology, but you are also a surgical skilled person. तो क्या क्या है treatment options?
सो स्ट्रोक इज ट्रीटेबल. जैसे स्ट्रोक क्यों होता है? क्योंकि कोई ब्रेन का ब्लड वेसल अगर सप्लाई अगर रुक गया है, उसके वजह से ब्रेन को डैमेज होते रहता है. तो इफ यू वांट दैट पेशेंट जल्दी रिकवरी आनी चाहिए, तो हमें उसका ब्लड सप्लाई रिस्टोर करना है. दैट इज द ट्रीटमेंट. सो हम पहले थ्रोम्बोलिसिस करते हैं, जिसमें ब्लड क्लॉट बस्टर मेडिसिन देते हैं, और जिससे बहुत बार वो आर्टरी खुल जाती है. इट इज वेरी एंड देन इट शुड बी डन विद इन टाइम 4.5 आवर्स. बट कभी कभी क्या होता है ना, ब्रेन की बड़ी वेसल अफेक्ट रह जाती है, जिससे थ्रोम्बोलिसिस काम नहीं करता है, या फिर पेशेंट 4.5 घंटे में नहीं आ पाते, थोड़ा लेट हो जाते हैं, या फिर देर आर सम कॉन्ट्रा इंडिकेशन, लाइक कुछ कुछ पेशेंट में ब्लीडिंग रिस्क है, तो हम मेडिसिन दे नहीं सकते. तो एक थ्रोम्बेक्टोमी एक ट्रीटमेंट रहता है. थ्रोम्बेक्टोमी इज वेरी पावरफुल ट्रीटमेंट फॉर द स्ट्रोक, एंड इट इज वाइडली अवेलेबल एटलीस्ट in Mumbai, and in nowadays in bigger cities. So it is widely available. Here what we do, it is not an open procedure like cardiologist enter into the artery. We puncture the artery, either radial or femoral artery. We take our catheters, we take our stents, retrievers, and some suction catheters, and we suck out the clot. And this procedure is safe. Same thing we do for the same thing we do for brain. We go into we have very good devices. If you ask me, if everything is okay, we can open the artery in 15 minutes once we start the procedure. Sometimes it may take time, and it is not like open surgery. We go it, and we have very good catheters available. So within no time, I would say within hardly few minutes, we reach the brain, we take the clot, and we suck it out, and we restore the blood flow.
This is so interesting, and I'm sure that you'll be in the safe hands if it's Dr. Vishal Chafale who's going to do it, who's an interventional neurologist, and he's available in CBD Belapur, Apollo Hospitals Navi Mumbai, and he can be consulted on Apollo 24/7 as well, because this is something very interesting, Doctor. Doctor, one quick thing here, I can see that people are asking about spasticity. पोस्ट ट्रीटमेंट भी हमें पैरालिसिस के बारे में बात करना पड़ेगा. अगर कोई पैरालिसिस के वजह से लिम्ब्स इफेक्ट हो गए हैं, कमल वैद्य जी पूछ रहे हैं हाउ टू रिड्यूस स्पैस्टिसिटी. कितने पीरियड तक लिम्ब ऐसा हो सकता है, एंड रिकवरी प्रोसीजर कितना होता है?
जैसे मैंने बताया कि स्ट्रोक इज अ डिसेबलिंग. सो व्हाट इज द डिसेबिलिटी? सो स्पास्टिसिटी इज वन ऑफ द कॉमन इश्यूज विद द पेशेंट विद द स्ट्रोक, स्पेशली इन द रिकवरी पीरियड. स्पास्टिसिटी क्या होता है? एक्चुअली इट इज अ नेचर्स वेज टू हेल्प यू. एक्चुअली मुझे अगर कोई हाथ मेरा कमजोर है, सो व्हाट नेचर विल डू, नेचर ट्राई टू हेल्प यू एक्चुअली बाय इंक्रीजिंग द टोन ऑफ द मसल so that you can use it. So it initially it is like flaccid, means there is a weakness, there is a flaccidity, and over few days, few weeks, you develop spasticity. Sometimes that spasticity is a problematic, like you may not move your joint freely, you may feel pain because of constant stiffening of the limb, you may develop some contractures. So we need to treat it. If it is impairing your it is not helping and it is causing problem, then we can treat it. So suppose you are doing physiotherapy, and due to spasticity you are not able to make it straight, or if you are making it straight and it is causing pain, then obviously we have to treat it. So we can treat it by giving some simple medicines, and we have other things also, like suppose it is a very resistant spasticity not responding, then at times we have to give Botox also.
अच्छा, तो जनरली पोस्ट स्ट्रोक अगर पैरालिसिस है, लिम्ब इफेक्ट हुआ है या फेशियल मसल्स इफेक्ट हुए हैं, तो क्या आफ्टर पूरा ट्रीटमेंट हो चुका है, हाउ लॉन्ग डज इट टेक? इंडिविजुअली डिपेंड करता है, या क्या टाइम लगता है रिकवरी में?
या एग्जैक्टली, इंडिविजुअली डिफर. फर्स्ट इज इंडिविजुअली डिफर करता है. नो टू स्ट्रोक पर्सन आर द सेम. लाइक हम बोलते हैं यार इनका स्ट्रोक हुआ था 2 वीक में ठीक हो गया, उनका तो 2 महीना हो गया, 2 साल हो गया, ठीक नहीं हुए. सो इट डिपेंड्स अगेन वेयर इज द स्ट्रोक. कभी कभी इतना बड़ा स्ट्रोक रहता है ब्रेन में, बड़ा एरिया इज अफेक्टेड, स्टिल यू डोंट गेट एनी सिम्टम बिकॉज इट इज नॉट दैट मच फंक्शनल टिश्यू. बट समटाइम्स इवन 2 mm ऑफ स्ट्रोक, ब्रेन स्टेम में छोटा सा स्ट्रोक रहता है, वो एरिया ही सपोज एक इतना छोटा एरिया ब्रेन स्टेम रहता है, लिटिल फिंगर इतना, अगर वहां पे 1 mm का भी स्ट्रोक हो जाता है, then you can have still paralysis. So stroke symptoms depend not on site, and severity depends on the area affected. And when I say the recovery period, initially 2 weeks is a time where it fluctuates. Like suppose a patient comes with a good power and next day he may develop some fluctuation. There can be weakness. Initially he can lift, next day he may not lift the limb. So initially there can be worsening. Sometimes there can be improvement also. So we don't call it improvement or recovery. We call it fluctuation, positive fluctuation, negative fluctuation. So all these things happen over the period of next 2 weeks. 2 weeks is a time where it is the convention, not conventional, it is like arbitrary time where the what is the cause of the stroke, whatever the mechanism which is active, which remains active and which may cause the stroke, and that part settles down. Suppose I get any
अच्छा,
injury, what will happen? Initially there will be swelling, then over the period of days it will
correct,
become stable. Same thing happens to the brain
subside.
injury also due to the stroke. Yeah. So in 2 weeks it stabilizes and then you get recovery. So that can be 3 months, 6 months. Gradually you get the recovery. It's like that.
Right.
There is no
So
time bound.
age के हिसाब से भी
And again, just a minute, I am interrupting. Stroke recovery is a long-term process. Even few years
अच्छा,
later, they say you keep taking. Yeah, so you should not leave the hope, and you should not lose the hope, and you should continue doing physiotherapy. And also, initially recovery will be very visible because from 0 to 1 you will notice it, but from 1 to like 4 to 5, it will be recovery still there, but you may not notice it. So you keep trying, keep doing physiotherapy. So recovery is a long-term process.
जी जी. So next question is a very simple question, but then I'm sure that lot of people would face this fear, anxiety में. योगिंदर कुमार वशिष्ठ का क्वेश्चन है, मेरे शोल्डर में स्टिफनेस रहती है और मुझे एंकुलोसिस स्पॉन्डिलाइसिस है, क्या इसके वजह से मुझे पैरालिसिस हो सकता है?
So, first of all, the stiffness is not due to the stroke. It is not a risk factor for the
जी.
stroke. So most of the time, in your age, with all these things, stiffness can be due to the frozen shoulder or some shoulder-related issues. So you should identify that. So if you ask me, ankylosing, you don't have the risk factor, but ankylosing spondylosis again, it is an inflammatory condition. So rarely it may increase the risk of the stroke in rarely, very rarely. I will not say it is not a known risk factor. But if it is severe, you can take a treatment from the rheumatologist to control the ankylosing spondylosis. So actually, it is not a
तो
known risk factor for the stroke.
सो एट दिस पॉइंट सर, जो योगिंदर जी जो क्वेश्चन पूछ रहे हैं वो बहुत ही इंपॉर्टेंट लगता है मुझे, क्योंकि हमारे डर भी होते हैं थोड़े कि आपने बोला है कि स्ट्रोक के जो सिम्टम्स है, अगर लिम्ब इफेक्ट हो रहा है तो इमीडिएटली या सडन चेंजेस को आइडेंटिफाई करना पड़ता है, बट ये कांस्टेंट पेन्स या कांस्टेंट पुलिंग, स्टिफनेस, नमनेस, नॉट एबल टू यूज द लिम्ब प्रॉपरली, ये धीरे धीरे भी डीजेनरेट होते रहते हैं. हाउ कैन वी डिफरेंशिएट बिटवीन दीज टू?
Okay. So suppose I'm take the example of वशिष्ठ जी, उनको शोल्डर में प्रॉब्लम है. ये सडनली नहीं शुरू हुआ है, होते 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 हुआ है. सो इट इंडिकेट्स कि ये सडनली नहीं हुआ है. जब शुरू कैसे हुआ है वो पहले हिस्ट्री लेना पड़ता है. दैट्स व्हाई वी टेक डिटेल हिस्ट्री. सो हिस्ट्री इज वेरी इंपॉर्टेंट इन आवर डायग्नोसिस रादर देन ऑल डूइंग एनी स्कैन एंड ऑल. So in his case, rather than I will say, if he is able to move it, limb it, so there is no weakness. So if he's able, he can't make it straight. Like shoulder is not, he is not able to make it straight. It is restricted because of some inflammation, some fibrosis in the joint. So that is the differential point between the stroke. In stroke, there will be weakness. In other things, weakness is not there, but you are not able to use the joint because there is some restriction, mechanical restriction or inflammation.
राइट. बहुत ही अच्छा बताया डॉक्टर विशाल आपने. नेक्स्ट क्वेश्चन इज एनी इफेक्ट्स ऑफ एंटी डिप्रेशन मेडिसिन्स, विल दैट कॉज, आई एम टेकिंग मिस्टर जयप्रसाद केतिरेड्डी wants to ask about this because he is taking OCD के लिए एंटी डिप्रेसेंट्स ले रहे हैं. So will this get in, will he have any side effects?
No, as a stroke, they are not. It is not a known risk factor for the stroke. It is not known.
Alright,
Yeah.
so all right. So next is Mr. Prashant Kulkarni. Prashant ji, four fingers of right hands are not working properly because बेड रेस्ट में थे वो 5 साल, वेंटिलेटर पे थे. मैंने उसके बाद ही इज नाउ LPT ऑफ स्टिफनेस इन फुट एंड फिंगर्स, इज अनएबल टू वॉक. तो इनका शायद कॉम्प्लिकेटेड केस है और हमारे पास ज़्यादा डिटेल्स नहीं है. इन सच केसेस हाउ डू वी help them,
So
doctor?
in case mein to I think we need to I need to see him I need to discuss him in this detail because as you mentioned complicated case long duration. So what his symptoms may rather than stroke I will say it is a lot of some changes in the nerve. If you are on ventilator for long time there can be some changes in the nerve and you can have numbness, stiffness, sometimes weakness of the some part of the distal part of the body parts. So it is not a stroke. If it is not occurring suddenly it may not be a stroke.
All right. So I think Kulkarni sir, it will be better that you can consult Dr. Vishal Chafale sir on Apollo 24/7 sir का link हमने description box में भी डाला है, chat में भी डाला है, and you will be able to find the link on Apollo 24/7 as well. So please go consult. There are especially sir neurological, especially stroke के यहाँ पर इतने complicated cases होते हैं जैसे आपने बताया कि ये प्लेटफॉर्म में शायद हम इन डेप्थ आंसर्स नहीं दे पाते हैं.
Exactly.
या
We
सो
need to understand.
डॉक्टर साहब आप बोल रहे थे कि फिजियोथेरेपी का भी रोल है स्पेशली पोस्ट रिकवरी में. उसका क्या रोल है एंड कब तक चलना चाहिए?
फिजियोथेरेपी इज वेरी इंपॉर्टेंट इन स्ट्रोक. स्ट्रोक जब इमीडिएट होता है तो मोस्ट ऑफ द टाइम सपोज यू आर नॉट मूविंग द लिम्स. So what happens? So if you are not using the limb, it will get atrophied. Muscle wasting will occur, and there will be the changes in the joint. Your optimum joint functioning will not be there. So physiotherapy helps in maintaining your muscle power, maintaining your joint positioning. So we start physiotherapy very early. Suppose the patient even of major stroke comes and we stabilize him hemodynamically, blood pressure, everything is stable, and he's not on major life support or like thing. We start immediately physiotherapy in ICU itself, and we continue it at home because initially you may need a full support of physiotherapy, then you need only guidance. So physiotherapy is a long term
जी.
thing. It's not like that every time you have to go, but initially definitely you should go to the you should have the intensive physiotherapy in initial few weeks I would say, especially in major stroke, and then you continue. It's long term process. It helps in good recovery.
Right. So here's Ashu who's trying to say, can we reach out to Dr. Vishal through telemedicine and how can I? शायद telemedicine online पूछ रहे हैं अशु जी. Dr. Saab, you are available on Apollo 24/7
Yeah, I'm
online
there.
platform.
We do consult.
Yes. Yeah. So my question is, because neurology is something that physically आपको देखना पड़ता है. I think she is asking about आप
We prefer,
symptoms
yes.
and ये online कैसे होता है? I think that's one question which a lot of people will have.
Yeah, exactly. So ideally, we prefer. So suppose a person from the Navi Mumbai or near Mumbai, they consult us. What we do, even in Maharashtra, we consult them and we keep it the link open and we ask them to come in person at their leisure in the OPD timings. We give them a slot, so they come for examination. Sometimes certain things, if already most of the people they want second opinion, like they are already being seen by other neurologists. In those patients, we have the clinical findings. But if we don't have, we prefer patient coming in person so that we can examine.
Yeah.
It makes a difference.
Done. So, Doctor, here's Rajendra Kumar ji, who is 80-year-old male and early symptoms of paralysis पूछ रहे हैं. Also, please do tell us about the risk factors in elderly population.
So early respect, see early symptom of the stroke again. We'll start with the fast face weakness. It can be simple, minimal face weakness. You may not even notice, like while some speaking difficulty or slurring of the speech. That can be the these things symptom. Sometimes there can be lot of loss of speech. So symptom can be mild, moderate, or complete also at the onset. Then you can have limb weakness that you know, but suppose there can be a mild weakness like 10%, 20% power is lost. Then you may have some clumsiness of the movement, like you are able difficulty in buttoning, unbuttoning, opening and unlocking, locking the door, or negotiating the footwears, holding it. They can be the subtle
जी.
weakness signs which you can notice. And obviously the frank weakness nobody will ignore it, but these are the subtle
Correct.
signs, because these are the signs where the stroke is evolving or stroke is mild, that nature is given a warning sign and you should take it seriously. Means suppose a TI, sometimes what happens, there are some minor stroke symptoms, they last for few minutes, few hours, and they recover. We do MRI is normal, but we call it TI. We take it very seriously because TI is a nature has given us a warning sign, something is wrong, identify
Right.
it. Because if you are, there is some mechanism which is driving, which may cause future stroke. This is a time where we can act and we can prevent that episode. So minor stroke, TIA, we investigate thoroughly. And most of the time we get some risk factor and we can treat it. It's like that.
Wonderful, wonderful. So, what can be the basic tests that one has to follow कि यंग एज में क्या चाहिए, मिडिल एज में क्या चाहिए, सीनियर्स के लिए क्या, एनी ब्लड टेस्ट और सिंपल टेस्ट जो मैं अपोलो 24/7 फॉर एग्जांपल ऐप में आप पूछ सकती हूँ, जो फिजिशियन रिकमेंडेड है.
Okay. So first of all, we should understand what is stroke is a vessel-related problem. There is something which happens in the vessels, diseases of the vessel, vascular problem.
Right.
So what are the risk factor
Right.
for the length? Then in blood test, if you specifically ask me, we should check for the sugars. Very very important. Fasting blood sugar, post meal blood sugar, and HbA1c, which gives 3 months of sugar. So most of the time, undiagnosed sugar. See, sugar will not cause any symptom. There will be sugar for few months, years. You may not have symptom, but that is damaging the body. So you have to identify. That only test you can identify, because by the time you get diabetes symptom, it is at least few hours, few weeks, few months will be gone. So we can identify early by doing blood test. Then I will recommend your lipid profile. In lipid, especially bad lipids, cholesterol, total cholesterol, and LDL. So we should have the level of this cholesterol. If it is very deranged, we have to start some medicines, or if it is moderately arranged, we can manage by some dietary interventions. And then other risk factor depending, like kidney functions and all. So these are the two blood tests, if you ask me. In young patient, we do lipoprotein A level also, because if it is elevated, it may hint that he may have some risk factor in the future. So you be careful. It's like that. And in certain population where they have some coagulation abnormality, so that test not routinely advised. We advise depending on the patient.
ओके डॉक्टर, सो दैट्स इट. डॉक्टर साहब ने एक सिंपल सा टेस्ट का लिस्ट दिया है. यू कैन कीप योर डायबिटीज अंडर कंट्रोल एंड मॉनिटर इट. इन केस यू आर नॉन डायबिटिक, प्लीज कीप योर सेल्फ informed and aware. So here's an interesting question. Arun Goelji, 58-year-old है, male है. He wants to know the main reasons of paralysis.
Okay. So main reasons, rather than reasons, I will say ki risk factors for the paralysis. So as we discussed, this is a vascular problem. So what are the risk factors for the cardiovascular illness like heart attack? Same are responsible for the brain attack. It is brain attack, just like that. So
अच्छा.
most common risk factor is uncontrolled hypertension. That is the most common risk factor for the recurrent stroke or stroke, especially stroke. It can be emerging
So
or
high
ischemic.
BP,
High BP, which
high
is
BP
treatable.
का monitor करो. हाँ,
High blood
which
pressure.
is treatable.
Then second is yeah. Then other risk factors are the sugars, especially they are uncontrolled. Then lipids, especially they are very deranged and you are not still you are not doing any dietary modification or some medicines. Especially LDL cholesterol, we target it in a stroke patient to less than 100 or less than 70 if there is a recurrent stroke. So these are the three these thing. Other things are like morbid obesity. We give more importance to truncal obesity rather than body
हाँ.
weight and all. Truncal obesity. So that is most common risk factor. Then sedentary lifestyle. Then apart from that, there are some other addictions. Smoking is very strong risk factor for any illness like cardiac illness, stroke, lung illnesses. So smoking is very important modifiable risk factor. Those who have risk of the stroke or who have suffered from the stroke due to smoking, so we should they are not advised to take to do it continue it. You should stop it as early as possible. Then alcohol is also not good. It controls, it changes your blood pressures and all, also increase the risk of the stroke. Then sedentary lifestyle. So these are the common modifiable risk factors nowadays. They are
So
common
BP
for the
का
stroke.
ध्यान रखिए. बीपी का ध्यान रखिए, डायबिटीज का ध्यान रखिए, लिपिड्स का ध्यान रखिए. जो आपके हाथ में है, स्मोकिंग अल्कोहल, उनसे दूर रहिए और एक्टिव रहिए. वेरी वेल पुट डॉक्टर
Exactly.
विशाल, थैंक यू. Yeah,
Exactly.
next question is Anupam Day, 42-year-old male. High triglycerides and paralysis, कोई लिंक है क्या डॉक्टर?
As I mentioned, paralysis, high triglycerides, it is a lipid problem, right? It is triglyceride, one of the lipid test where triglyceride high. But I would say it is a risk factor. But rather than when we treat a patient of the stroke, we target more of a LDL cholesterol. So triglyceride is also risk factor, but rather than triglyceride, I would say LDL is a more bad cholesterol. We call it. We target the LDL cholesterol. So we should have, rather than only doing triglyceride, we should do detailed cholesterol profile, lipid profile, fasting cholesterol profile, and that gives better idea. Yes.
Okay, sir. Sir, यहाँ पर we were also talking about how our cholesterol इम्पॉर्टेंट है, तो डाइटरी कुछ होता है क्या सर कि ये खाते हैं तो जनरली कॉमन मिथ्स होता है कि ये खाओ ये मत खाओ, ऐसा कुछ डाइटरी रेस्ट्रिक्शंस है या इज देयर एनीथिंग दैट कैन हेल्प अस स्टे स्ट्रॉन्गर एंड अवॉइड रिस्क?
Exactly. Yeah, nutrition is very important. Nutrition in a stroke is very important. There are some diets, foods which are recommended to in a stroke patient, or we should do as a overall to reduce the risk and cardiovascular risk. So we should have the adequate amount of fruits because fruits are the natural source of antioxidants. They reduce the vessel damage. So then second thing is fruits, then green leafy vegetable, whole grain cereals. They contain good fibers, folate. They reduce the cholesterol level. They reduce the constipation. So these are the things we can have in your diet regularly. Then we should have a avoid what should be avoided like monosaturated fats, like saturated fats and
हाँ,
monosaturated, especially in diet. So what are the things nowadays we have junk foods we call it because we call them junk food. They are like pastries, then cheesecakes, then we call it then burger, pizzas. They contain and
all
then
junk.
potato chips and all. They contain high quantity of these saturated fats, so it is not good for the blood vessel and especially those who are having risk. So it is strict no if you are having a risk factor for the stroke. So that should be avoided. Then we should avoid the salt, excessive salt. We recommend in suppose you are in a risk of the stroke or you are having blood pressure which is borderline or your parents or any family risk factor of the stroke is there, then restrict your salt intake to around 2.5 gram per day. So it will help in reduction in the bloods. That is first thing. Then you should avoid any drinks which contain added sugars, like any
Okay.
soft drink, carbonated drinks, or any juice. Also, they you should understand the sugars containing because ultimately it is not good for your your body in terms of the reducing the risk factor for the stroke and heart attack. So it is not recommended. And
इसी
then you
नोट
should
पे ना
have
हमारे
healthy.
बच्चों को रीडिंग लेबल्स एक आदत सी बनवाना चाहिए, you know, right
Yes,
from childhood we should tell our children to read labels and understand what's there inside.
exactly. That is very important nowadays. Subconsciously, we take lot of sugar, lot of things we should not have in our diet. So we should have the list
जी,
of no items rather than having what we should take.
wonderful doctor. Sir, here was Manoj Tyagi ji. He had a hemiparalysis in 2008 on left side of the body. What are the chances that I might get a relapse?
Yeah, good question. Very good question. So when we say in a stroke, it is not like we should treat it. Okay, but we should also try to identify why it is there. There must be some reason
हाँ,
because until we call it mechanism of stroke. If you don't treat the mechanism, there is high chance it may recur. So what are the mechanisms of the stroke? So there is some. First of all, we should divide which stroke which is ischemic or hemorrhagic. There are some mechanism for the ischemic stroke and some hemorrhagic. Now I am discussing ischemic stroke, which is very common. So there is a clot in the brain. From where the
correct.
clot is there? Why there is a clot there? Either clot is formed there only. We call it small vessel disease. Small
जी,
blood vessels which develop atherosclerotic changes and they just shut down. We call it small vessel disease. That is one of the risk factor mechanism. Then second is something at heart is at fault, like heart may have some abnormal rhythm problem, sometimes wall issues, sometimes hypokinesia of the wall. There can be a clot formation which goes into the brain and they cause stroke. We call it cardioembolic stroke. Then sometimes there can be arteries. Suppose my carotid artery which supplies the brain, vertebral artery which supplies my this thing, small brain. Suppose they have some narrowing or very severe narrowing. So there can be reduction in the blood flow. We call it watershed stroke, or sometimes clot can be formed. So there are different mechanisms. So we have to address the mechanism and we have to treat it. So suppose I mean cardioembolic stroke due to atrial fibrillation. The treatment will be not be aspirin. It will be different treatment. Patient needs anticoagulation. Suppose I have severe narrowing where actually the blood flow is restricted. So you have to open the artery by putting a carotid stent until otherwise patient will getting a stroke, which can be a major stroke. So identify the mechanism
जी,
of the stroke. Yeah.
वेरी इंपॉर्टेंट, बट दैट रिलैप्स हो सकता है अगर कॉज ट्रीट नहीं किया है तो. वेरी इंपॉर्टेंट, थैंक यू सो मच सर. Kiran Mahavratiyajula, he's asking this question: can you please explain how a poor oral hygiene is associated with higher risk factor for stroke?
Oral hygiene is, I would say, it is it is actually linked to everything, because ultimately it will affect your this thing, your food intake and everything. It will be affected by the poor oral hygiene. And also, if you are having poor oral hygiene, ultimately you will have more risk of having other infections also if you don't. And poor eating habits also means, if it will cause a tooth caries and all, you may not take adequate amount of the good nutrient food and you will restrict it. So in that way it can be linked.
So it's not directly linked कि
Yeah,
अगर
indirectly you can
cavities है.
link it. Yeah, exactly.
ओके ओके डन. सो योगेंद्र कुमार वशिष्ठ जी जो पहले क्वेश्चन पूछ चुके हैं वो अभी पूछते हैं. हिज डॉटर हैज Erb's palsy in her right hand by birth. She is now 8 year old. Any further treatments for this?
First of all, Erb's palsy actually most of the time it is a like birth trauma like thing. Here now we have to see how it is partial or complete. It is not a stroke, first
जी.
of all. It is some nerve damage to the nerve fibers, which is causing the shoulder weakness. So, or in the hand weakness. So that is Erb's palsy, especially shoulder weakness. So here, if it is partial, it can be treated by doing physiotherapy, optimum maintaining. But suppose still there is a very severe and she is not able to move at all, then we have in this age, at this stage, we can have a tendon transfer procedures. So they can consult us. We can plan treatment for us, and we can do that. Suppose
Wonderful.
somebody's hand is not moving, we can transfer the tendon which is moving the other muscle, and you can achieve that movement. It is possible.
अच्छा, तो what age is this recommended, doctor? Because ये तो 8 साल बच्चे की बात कर रहे हैं.
Now that's why we need to see what is the status of the muscle, because suppose something is weak, there is atrophy of the muscle. So what are the
जी.
functioning, what is the joint functioning, accordingly we plan treatment. Earlier is better, that's what they say. Yeah.
जी. तो योगेंद्र वशिष्ठ जी, डॉक्टर साहब का लिंक हमने दिया हुआ है. प्लीज डू कंसल्ट फर्दर. Varun Kumar, you have not received health credits for the last week's quiz. We will definitely take your request, and I request the team to kindly look into this. Next question, Dr. Mukesh Kumar ji का है. 54-year-old है. He is taking certain medicines. I'll quickly read the medicines. He feels dizziness whenever he stands and moves. He's taking Rosocor, ASP, Tazloc, Metpure, Jubinerve for hypertension for last 5 years. Each time he's getting up and moving, he has dizziness.
So first of all, we need to see what is happening. Whenever he's getting up, at that time only he's getting dizziness. So there are two ways, two common. I would like to find out the cause. First of all, is there any postural drop in blood pressure? Suppose you are lying down, you are okay, and suddenly you are getting up. There may be a precipitous fall. So in his case, we generally check lying down and standing BP. If there is some change, it can we have to change some medicines of your hypertension and all. Then second thing again, you may have some balancing issues when you change your position with respect to the gravity, you are getting symptom. So sometimes a mild vertigo can present like this, or there can be other risk also, but these are the common things in your case, possibilities.
All right, sir. Thank you so much for taking time out there. Next question is, can a surgical operation of spinal cord can cause paralysis in patient?
Surgical operation paralysis, yeah, it depends for what for what surgery we are doing. Suppose you are doing some surgery for the spinal cord hematoma, spinal cord something, so due to that you can have weakness, but surgery causing this weakness is rare. But rarely, in rare condition, it may happen. We will not call it paralysis, we call it means it depends. Suppose my cord is affected, you may have paraparesis, paraplegia rather than paralysis. It is not like,
Okay.
I will not say it's a stroke like paralysis, but it is a like depending on the symptoms, where depending on the lesion level of the lesion you may have. High cervical is affected, you can have quadriparesis. Thoracic or down, you can have only lower limb weakness.
So,
So in that
yeah,
way,
that's a very rare case, and it's not
I would
paralysis,
say I
basically.
would say it is not common in routine spine surgeries. Like when you say spine surgery, they are generally done for the low back pain and then cervical
Correct.
this thing. So generally, I have not come across commonly, because they are commonly done and they take precaution. Doctor take precaution before doing such surgeries. Yeah, yeah.
Yeah, so डरिए मत. Next question is Balaji Rao's question. Balaji's father is 60-year-old. He's suffering with the left MCA stroke. It's almost 15 months now. He's still unable to walk properly, no hand movements yet, lost his cognitive function and speech. Chances of recovery, please.
Yeah, as I mentioned, stroke recovery a long-term process. You keep doing all these things. In what happened in the left side? No, it is our dominant part of the brain, I'm talking, you are understanding, and then you what you want to say, your brain is forming something information and it is giving command to your speech. So that's how words are formed. So that ability is affected in this patient, in these patients with a left-sided stroke, dominant hemisphere. So you should do speech therapy. Sometimes there can be weakness, and with that weakness you can do your day-to-day activities. So you can encourage him in rather than restricting the bed rest. So you can do the good physiotherapy, and speech therapy will help you. And certain sometimes some medicines also we give which have a good effect in the speech improve, like memantine is available, which help have a good role in the improving the speech, or aphasia
Acha.
after the stroke. We call it aphasia.
Okay, doctor. Thank you. And Ashu's question is, my mother is 58-year-old. May she suffered severe hemiplegia in right side from 1 year. BP, she does not have BP or hypertension. She's she's always fit. How is it possible? And what are the chances of recovery at this age of 58? Okay, so उनको 23 अभी ये May 23 2023 में stroke हुआ है सर, but she doesn't have BP. She's very fit. She's only 58-year-old. पर फिर भी हुआ है. Chances of recovery and कैसे हुआ है?
Uh, एक तो पहले देखना पड़ेगा हमें स्टडी पर ना पेन स्ट्रोक कहाँ पे हुआ है. अगेन establish the mechanism in her case. So good thing is she's not having a risk factor. Sometimes we also, after extensive investigation, we don't find a cause. We call it embolic stroke of undetermined source. Sometimes you may not, because the mechanism which was active at that time, if I'm investigating, you may not find the mechanism which is not active. So in such patients,
Correct.
recovery, generally recurrence is not that much. If you are having uncontrolled risk factor, and we don't know risk factor, so if you say risk is not that, recurrence is not that much, but we should be careful. We should thoroughly investigate. We should do arterial studies, like we should do angiogram, MR angio or CT angio. We should do detailed cardiac workup. We should do Holter. We do rhythm monitoring of the heart, which is very simple. There's some small devices there which maintain, which records your rhythm. Sometimes we extend in such patients for 2 days, 3 days, and we find out some abnormalities, atrial abnormality like atrial fibrillation. We can treat such patient. So we need to review his case, and obviously sometimes we find a hidden cause.
Okay, doctor. Urmi Bhattacharya, who's 66-year-old female, how do I minimize my risk of being paralyzed and undertake preventive measures? Especially my maternal grandmother had paralysis. So she's worried कि अगर ये hereditary है.
Okay, so how old is she now? I just missed the age.
66.
She's 66 now.
Yes, doctor.
Okay. So again, you should be like I just screen yourself after at certain age. We should do regular health checkups, where which includes your blood pressure, diabetes, lipids. Sir, everything you can't check, but at least these are the basic parameters you can have. If you find that you are having this risk, then you target the risk factor. If you have dyslipidemia, you should avoid having saturated fats in your diet. You should have regular 30 minutes of walk. Then you should have moderate salt intake. Then you should have, if it is still not under control, you can take the medicines for that. So I think this is what you can do: maintain the good lifestyle, avoid good nutrition, proper diet, and 30 minutes of walk is recommended, which will help. 30 minutes of walk 5 times in a week, that is what recommended for every cardiovascular strict prevention, or same thing applies to the brain also. And in generally it is not hereditary stroke, I would say, in her case, because in her grandmom, because see what happened now, out of anxiety we get panic. So suppose I come across an accident, so I don't stop driving my car, right? I will take precautions why it happened. So rather than having a worry, we can identify the risk factor. Some in your age and genetics are not in your hand, but other things are in your hand.
सर जो एंजाइटी के बारे में बात किया, इतने सारे हमारे रजिस्टर्ड यूजर्स स्ट्रेस एंड एंजाइटी, अभी वर्क रिलेटेड स्ट्रेस हो या पर्सनल एंजाइटी हो, इनके बारे में पूछा है. Is stress, high stress and anxiety a reason for brain stroke and paralysis?
I will not say they are directly, but they are obviously a contributing factor. They will cause, they are actually secondary cause of the increased blood pressure and all. And so in that way, they can increase the risk of not only stroke, they will risk to the all risk of all type of cardiovascular problems, cerebrovascular problems. So it is not direct, but it is indirectly related. You can correlate them with the stroke or heart attack.
Okay.
But not directly related. Most of the time, out of anxiety, we get panicked and we we get a lot of palpitation, become lot of across a lot of young people who come to the ER itself because they out of panic, out of so much anxiety, they get panic, and then uh, we have to explain them that no need to worry, and but obviously we screen them for certain risk factors, and if everything is not there, we give them assurance.
जी, जो किसी और को लीड कर सकता है, वो किसी और को लीड कर सकता है, डोमिनोज इफेक्ट कर सकता है, तो स्ट्रेस को हम पहले कंट्रोल कर ले. दैट्स इन आवर
Exactly.
हैंड्स.
Nowadays, yeah. We are everybody is having stress out. Every living thing will have stress. So stress when it occurs now, when your resources are not able to handle the problems. So you take help. That is the best way to avoid the stress. Because you are
जी.
trying to solve a problem which is beyond your resources, then there is a stress.
Ji, ji. So next question is Yaneshwar Bhuyan, and two questions which are similar in nature. Let me club the questions. Yaneshwar Bhuyan and Tarun Bisen. Yaneshwar ji is 61-year-old and he had the left side paralysis last year हुआ है, and अभी भी उनका movement वापस नहीं आया है. And Tarun Bisen is 26-year-old male. He suffered from hemiparalysis of the left side of the body. Recovery in left hand and fingers is stagnant and the situation is not improving. Can you help?
Okay. So stroke recovery, what happens now, ultimately depends on the type of what area the brain is affected. Similarly, there are
Ji.
certain parts of the body take a lot of brain area. Like my thumb, it's a small finger, but it has a lot of actions. So similarly, its representation in the brain, it occupies a lot of hard disk, like in computer. Take a lot of hard disk. So that's why the small joints or fine movements on the hand, they take time for recovery because it takes a lot of recovery in the brain, so they are last to recover, but you should keep trying doing simple exercises, like you can use the smiley ball which help in maintaining the muscles. Then you can start writing, hold the pen, you start writing, that is also simple exercise at home you can do, and gradually you see every week your pattern, whatever diagram you are drawing, it will improve. So these are the simple tricks, and you can take physiotherapist help, they will definitely help.
यस, सो आपने बहुत अच्छी बात कही है कि ब्रेन रिकवर हो रहा है यहाँ पर. देयर इज एन ऑर्गन व्हिच इज डीलिंग विद रिकवरी प्रोसेस, सो वहां पर लोड ज्यादा है. प्लीज कंटिन्यू डॉक्टर, यू वर
Definitely,
सेइंग समथिंग.
definitely. So see, suppose my problem is in a switch and my fan is not working. My speech, I'm repairing my switch after 1 year, and suppose fan is not in a functional position, it will not recover. Similarly, my brain is a switch; it is acting on my finger, hand, and limbs. And suppose my recovery is taking time, so you have to maintain the muscle bulk, your joint positioning for better recovery. So that's where the rehabilitation or physiotherapy comes, which maintains our positioning of the limb till brain recovers.
जब आपका स्विच सही हो गया तो आपका फैन सही फंक्शन होना चाहिए, वो खराब नहीं होना चाहिए, तब तक आप काम करते
Exactly,
रहिएगा.
exactly. You should maintain
Yeah.
because ultimately that
वेरी सिंपली सेड डॉक्टर, बहुत अच्छी तरह से आपने एक्सप्लेन किया है. थैंक यू. वन नेक्स्ट क्वेश्चन इज डॉक्टर नितिन गोयल पूछ रहा है, ब्रेन पैरालिसिस ऑन द राइट साइड, स्पीच इज अफेक्टेड सिंस 1 year. Suggestions please.
right side speech therapy. See, you do speech therapy again. See, if you say I E U, just I'm just I E U A I, it starts from the A here, and it ends in your lips. So these are the simple like exercise you can do to improve your speech. You activate from here, and you come up back to. So you stress the some sounds which are not able to. You try to do that. You, especially the joint jodakshar we call it, like joints words, so they are difficult to pronounce, so you try and concentrate your efforts on that. You take a help of the speech therapist, they will guide you in better way. So these are the things, simple
Wonderful.
tips and tricks at home you can do. I'm just telling them.
Yes. Atreyi Haldar, sir, I have left partoid arteriovenous malformation surgery last year, but I have permanent severe uneasiness and stiffness in throat, head, face, neck, and sometimes in shoulder. Any treatment?
First of all, they may not be related to your AVMs because it is some restricted. Suppose we are expecting something, you should cause some whole body involvement on the other side. So, first of all, try to find out the other causes for your symptom. And brain AVM,
Ji.
what treatment you did accordingly, and it depends what type of AVM is there, how large it is. Sometimes the surgery may not. Sometimes what we think everything is related to the AVM may not be related to the AVM. So please consult a doctor first. Try to find out the nature and link them whether with AVM or something else. जरूरी नहीं है मुझे AVM है तो everything is due to AVM. There can be other risk, other cause also.
जी जी बालकृष्ण 65-year-old मेल है. आई वॉन्ट टू नो अबाउट नमनेस एंड टिंगलिंग इन द बॉडी, एंड ये कोई पैरालिसिस के सिम्टम्स है क्या?
Numbness and tingling again. Stroke means it will occur in a particular region brain. It's not like whole brain will affected in the stroke, right? Rarely it can affect, but rarely tingling numbness. Suppose it is happening in one part of the body, can be a symptom. If my sensory affect area of the brain is affected, you can have those symptoms. But normally, what you are describing, these are generalized tingling numbness. So there are a lot of causes. First of all, they can be just non-specific. Then you can have a neuropathy. You can have spondylosis, some radiculopathy, in giving some numbness in the limbs, finger. They are very common. So I think these are the common causes of the numbness rather than thinking of a stroke.
जी ठीक है, थैंक यू सो मच. ये जनरली हम डरते हैं, मोस्ट ऑफ देम यू नो एवरी साइन एंड सिम्टम दैट वी आर लुकिंग आउट फॉर अ सीरियस प्रॉब्लम. इट्स गुड टू बी अवेयर, बट एज यू सेड वी शुड नॉट लुक एट द we should also look out and find for the actual cause of it.
Yes.
तो डॉक्टर, हाउ अबाउट द डेफिशिएंसीज दैट इंडियंस हैव? जैसे हमारे यहाँ पर B12 डेफिशिएंसी होता है, कैल्शियम डेफिशिएंसी होता है, D डेफिशिएंसी होता है. Any relations to these vitamin and mineral deficiencies?
If you ask me relations with the stroke, yeah, see, all deficiencies, if we know, we should correct them. Like vitamin B12 deficiencies, they are very common in vegetarians. Because most of the vitamin B12 active form, they comes in the in non-vegetarian diet.
No.
So vegetarian generally they lack in vitamin B12. Or sometimes you can have absorption problem and you may develop vitamin B12. So vitamin B12 sometimes may cause increased homocysteine in the body, which is atherogenic. So that may cause the risk of the coagulation in the blood. So in that way it is related. But if you ask me, it is not like a common risk factor, but we screen because it is treatable. So if you have deficiencies of the common vitamins, no harm to take because they are simple tablets are there. You take them or just take the diet adequate in the B12.
Gee. Quickly, my last question, almost two last questions that I'll take. Prabhash Chowdhury. My father's 85-year-old. He's all okay, but he's suffering from constant headaches. Any risk factors?
So headache in elderly, if somebody is coming with a 80-year-old male with a new headache, we take it. We should rule out other causes. Same headache, 20-year-old, I will think of other causes. Like in his case, I would rule out. Most of the time, we get clue on the history. When I personally talk with the patient, I examine. I know that this headache is serious or not. So generally, we get some at least basic imaging in elderly and headache. There are a lot of causes. There can be some abnormal reasons for the headache. Sometimes there can be simple headaches also which are treatable, like hypnic headaches. We are common, just giving simple tablet they will help. So ultimately, to answer your question, I need to talk to your father. I need to examine, so I can definitely treat it.
Gee, thank you. Ramya Nagaraj's question, probably this will be the last question for today's session. Her father had a CABG at 83-year-old, carotid clot addressed with medicine. He is a diabetic, low sodium. Sometimes legs cannot have strength to stand. Is it a neurological or a cardiac issue?
Again, in this age, difficulty in standing or maintaining balance. So it can be it is obviously it is neurological, but whether it is abnormal or not, sometimes your vestibulopathy, age-related degeneration of your balancing apparatus may cause imbalance, or sometimes there can be because he is having all risk factor for the heart. Like same thing, he is having risk factor of the stroke also. So again, on examination, we can find out the exact cause of his imbalance. Sometimes again, simple medicine change also will help him.
Yes. Lizzie Gachaji, your chest and joint pain cannot be answered on this episode, but we have done an episode which is about joint pain and chest pain as well. A lot of episodes that are linked in this health art format. Please go ahead and check those. A lot of people are asking about many similar questions, so most of the questions are answered. Thank you, Dr. Vishal, and I would now want you to give us top tips to reduce the risk of paralysis and brain stroke.
So first of all, we should understand that stroke is a leading cause of disability. Most of these strokes are preventable by preventing the risk factor of the stroke. Some risk factors are treatable, like uncontrolled hypertension, uncontrolled diabetes, uncontrolled lipids, we call it dyslipidemia. Some are avoidable or modifiable by doing lifestyle modification, like avoiding smoking, like drinking, avoiding the sedentary lifestyle, reducing the weight, and having a food which is rich in antioxidant. So, including those foods in your diet, you can reduce the risk. And we should understand that stroke is treatable, not only preventable, it is also treatable. Treatment is possible within by doing thrombolysis, which is possible in 4.5 hours, and by mechanical thrombectomy, where we open the artery. So stroke is treatable and preventable, provided you should reach in hospital in time. So act fast, because time is brain.
Absolute delight you were, Dr. Vishal Chafale. Thank you so much for being with us on the Sunday morning. And as you said, act fast. ये मंत्रा जब हम जपेंगे तो सबको reach out कर पाएंगे, and more awareness and lesser issues with brain stroke. Thank you so much. Namaskar.
Thank you everybody.
Thank you, sir. So here's the time that we conclude the show with Doctor, but now your time starts. I'm going to ask you 3 questions. Health quiz coming up. We are going to ask you 3 questions on YouTube chat you need to answer. You must be watching this on Instagram or Facebook, but if you want to participate in the health quiz, you need to type it out on YouTube chat only. From that's where we are going to pick our winners. And winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name, winners, you have to write back with your contact details to marketing@apollo247.com. Gift vouchers will be shared with you. And I see that 2 or 3 winners from the last week have still not received their health credits. We will definitely look into it, and we shall credit them as soon as possible. And here are 3 questions for this week. The first question is fill in the blanks. A problem with the nervous system causes what? P से शुरू होता है, S से end होता है. आज का topic वही था. Please fill in the blanks. A problem with the nervous system which reaches to the brain that causes. P से शुरू होता है. Please fill in the blank. Question number 2. True or false? The inability to move any part of your body or to move at all is the primary sign of paralysis. Is that true or false? Question number 3. Yes or no में answer कीजिए. Paralysis most commonly affects face, hands, feet or vocal cords. Please answer in yes or no. A lot of people have started answering on YouTube chat. So let's see who the winners for this week are. In the meantime, let me give you the discount vouchers that you can use them on Apollo 24/7 platform. The first discount voucher that we are giving away today is AskDoc150, ASKDOC. That's the code you need to use on Apollo 24/7. And you can consult top doctors direct from Apollo and get 150 rupees cashback on online doctor consultation. And the next coupon that we are giving away is code FIRST3. Order medicines direct from Apollo. Get 25% off on online medicine orders. This is valid on the first 3 medicine orders above 1,000 rupees of worth. And you must be knowing that when you order medicines from Apollo 24/7, you get a 2-hour delivery window too. So go ahead, download Apollo 24/7 and use these coupons. And as Health Our viewers, we have a special code for you. Use the code HH247, and this code will get you up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. And this is a code which you can use in addition with the other codes that we have given earlier too. And also, let me remind you that Apollo 24/7 is now on WhatsApp. You can text or just call 9355247247. This is the number that you got to save to avail healthcare services of Apollo 24/7. Go ahead and save this number. WhatsApp pe bhi Apollo 24/7 is available right now. Next week, we are going to talk about an interesting topic. We're going to talk about weight management in diabetes, thyroid, liver, and sleep disorders as well. It's an important topic, so join us on next Sunday, 16th July, 11 a.m. We are going to talk about weight management in diabetes, thyroid, liver, and sleep disorders. And the winners for today are Annu, Abhishek, and Rajesh Kumar. I repeat the names: Annu, Abhishek, and Rajesh Kumar. Please write back to us at marketing@apollo247.com with all your contact details, and we shall share the gift vouchers with you. Thank you all for joining us on this Sunday morning. फिर मिलते हैं अगले हफ्ते 16 जुलाई. नमस्कार.